Welcome to Lesson 6 of the ICD-10-CM course. In this lesson, we will study Chapter 1, Certain Infectious and Parasitic Diseases, covering code range A00 through B99. This lesson is part of the KS Medical Coding Academy full course. Why Chapter 1 is important? Chapter 1 is one of the most important chapters in ICD-10-CM. It includes high-risk and life-threatening diagnoses, such as sepsis, HIV, and tuberculosis. This chapter carries heavy weight in CPC, CCS, and CIC exams and includes strict sequencing rules and multiple code first and use additional code instructions. Chapter 1 Code Range. ICD-10-CM Chapter 1 covers code range A00 through B99. This chapter includes bacterial diseases, viral diseases, parasitic infections, sexually transmitted infections, HIV, and sepsis. Correct identification of infection type is essential for accurate coding. General coding principles. When coding infectious diseases, always identify the organism, the site of infection, and whether the condition is acute or chronic. You must follow sequencing rules carefully and always follow any code first, or use additional code notes in the tabular list. Organism versus site. Some infection codes specify only the organism, some specify only the site, and others specify both. If the organism is not documented, use the unspecified organism code. Never assume an organism without provider documentation. Categories within Chapter 1. Chapter 1 is divided into multiple sections, including intestinal infections, tuberculosis, zoonotic bacterial diseases, other bacterial diseases, sexually transmitted infections, HIV, viral diseases, fungal infections, protozoal diseases, and helminth infections. Knowing these sections helps you locate codes quickly. Acute versus chronic infections. When both acute and chronic infections are documented, assign both codes. Always sequence the acute condition first unless a combination code exists that describes both conditions together. Combination codes in Chapter 1. Some Chapter 1 codes are combination codes. These may include the infection plus the organism, a manifestation, or a complication. Always verify combination codes in the tabular list before assigning multiple codes. Use additional code notes. Many infection codes require additional codes. Common additional codes identify the organism using B95 through B97, organ failure, drug resistance, or complications. These notes are mandatory, not optional. B95-B97 Overview. Codes B95 through B97 are used to identify the infectious organism when it is not included in the main diagnosis code. Examples include B95.6 for Staphylococcus aureus, B96.20 for E. coli, and B97.89 for other viral agents. When not to use B95-B97. Do not assign B95 through B97 when the organism is already included in the primary code. For example, sepsis due to MSSA already identifies the organism, so an additional B95 code is not needed. Excludes notes in Chapter 1. Chapter 1 contains important excludes notes. Common excludes 1 rules include sepsis versus localized infection, HIV disease versus asymptomatic HIV, and acute versus chronic tuberculosis. Always review excludes notes carefully to avoid incorrect code combinations. Sepsis Overview. Sepsis codes are found in categories A40 and A41. Sepsis is a systemic response to infection and must be distinguished from localized infections. Sepsis versus bacteremia. Sepsis and bacteremia are not the same. Sepsis is a systemic illness coded from A40 or A41. Bacteremia is simply the presence of bacteria in the blood and is coded as R78.81. Coding sepsis. Basic rule: when sepsis is present, code the sepsis first. If there is a localized infection, code it next. If severe sepsis is present, organ dysfunction codes must also be assigned. Severe sepsis definition. Severe sepsis is defined as sepsis with acute organ dysfunction. Examples of organ dysfunction include acute respiratory failure, acute renal failure, shock, or encephalopathy. Severe sepsis coding. When severe sepsis is present, 3 components are required. First, code the sepsis. Second, assign a code from R65.2 for severe sepsis. Third, code the specific organ dysfunction. Septic shock. Septic shock is coded using the sepsis code along with R65.21. Do not code hypotension or shock separately when septic shock is documented. Sepsis sequencing rule. If sepsis is present on admission, the sepsis code is sequenced first. If sepsis develops after admission, code the underlying condition first, followed by the sepsis code. Neonatal sepsis. Neonatal sepsis is coded using category P36. Never use A40 or A41 for newborns. Urosepsis. Urosepsis is not a valid diagnosis code. If the provider documents sepsis, assign a sepsis code. If only a urinary tract infection is documented, code the UTI. Always query the provider if documentation is unclear. Tuberculosis overview. Tuberculosis codes are found in categories A15 through A19. Coding requires documentation of the site, whether the disease is respiratory or non-respiratory, and whether the diagnosis is confirmed or suspected. Active versus latent TB. Active tuberculosis is coded using A15 through A19. Latent tuberculosis infection is coded as Z22.7. Never code latent TB as active disease. HIV overview. HIV coding uses 3 main categories. B20 is used for HIV disease, Z21 for asymptomatic HIV status, and O98.7 for HIV complicating pregnancy. Correct sequencing is extremely important. HIV coding categories. HIV-related conditions are coded using 3 main categories. B20 is used for HIV disease when the patient has symptoms or HIV-related illness. Z21 is used only for asymptomatic HIV infection status. O98.7 is used when HIV complicates pregnancy, childbirth, or the puerperium. Choosing the correct category is mandatory for accurate coding. B20. HIV disease. Use code B20 when the patient has HIV disease. This includes HIV-related illness, opportunistic infections, or HIV-related conditions. Once B20 is assigned, it must be used for all future encounters, even if symptoms improve. Z21. Asymptomatic HIV. Z21 is used only when the patient is HIV positive but has no symptoms and no HIV-related conditions. Once the patient develops HIV disease, Z21 must never be used again. HIV coding rule, very important. This is a critical HIV coding rule. Once a patient is coded with B20, you must never use Z21 again. Always continue using B20, even if the patient is stable or symptoms are controlled. Opportunistic infections. Opportunistic infections occur due to weakened immune systems in patients with HIV. Common examples include pneumocystis jirovecii pneumonia, Kaposi's sarcoma, candidiasis, cytomegalovirus infection, and toxoplasmosis. HIV with opportunistic infection coding. When a patient has HIV disease with an opportunistic infection, code B20 first. Then code the specific opportunistic infection. For example, HIV with pneumocystis pneumonia is coded as B20 followed by B59. HIV with tuberculosis. If a patient has HIV disease and active tuberculosis, sequence B20 first. Then assign the appropriate tuberculosis code from A15 through A19. Tuberculosis is never sequenced before HIV disease. HIV with non-HIV condition. When the condition being treated is not related to HIV, code the non-HIV condition first. Then code B20 as a secondary diagnosis. For example, trauma with HIV disease is coded with the trauma code first, followed by B20. HIV in pregnancy. For HIV complicating pregnancy, sequencing is very important. First, assign O98.7 for HIV complicating pregnancy. Second, assign either B20 or Z21. Third, add the weeks of gestation using Z3A. Bacterial infections overview. Bacterial infections are commonly coded from categories A30 through A49. These codes may be site-specific or organism-specific. Many bacterial infections require additional organism identification codes. Sepsis versus localized infection. When both sepsis and a localized infection are present, always code sepsis first. The localized infection is coded second. For example, sepsis with a urinary tract infection is coded as A41.9 followed by N39.0. Sepsis with organ dysfunction. When sepsis is accompanied by acute organ failure, severe sepsis is present. A code from R65.2 is required, and the specific organ dysfunction must be coded separately. Implicit severe sepsis. Severe sepsis does not have to be explicitly stated by the provider. If documentation shows sepsis plus acute organ failure, severe sepsis is implied, and R65.2 must be assigned. Sepsis example. In this example, the provider documents sepsis with acute respiratory failure. The correct coding is A41.9 for sepsis, R65.21 for severe sepsis, and J96.00 for acute respiratory failure. Septic shock. Septic shock requires two codes. First, assign the sepsis code from A40 or A41. Second, assign R65.21 for severe sepsis with septic shock. Do not code shock or hypotension separately. Sepsis not present on admission. If sepsis develops after admission, code the underlying condition first. Then code sepsis. Always follow present on admission indicators for inpatient cases. Viral infections overview. Chapter 1 also includes viral infections such as influenza, COVID-19, viral hepatitis, viral meningitis, and viral encephalitis. Each has specific sequencing and documentation rules. Influenza coding. Influenza codes require identification of the virus type when known and any manifestations such as pneumonia or respiratory involvement. Always check the tabular list for combination codes. COVID-19 coding. When COVID-19 is confirmed, assign code U07.1. Do not use exposure codes like Z20.822 when infection is confirmed. COVID-19 sequencing. When COVID-19 has complications, code U07.1 first. Then code any associated conditions such as pneumonia or acute respiratory distress syndrome. Viral hepatitis overview. Viral hepatitis codes include hepatitis A, B, and C. Hepatitis A is coded from B15, hepatitis B from B16 through B18, and hepatitis C from B17.1 or B18.2. Acute versus chronic hepatitis. When both acute and chronic hepatitis are documented, assign both codes. Sequence the acute condition first unless a combination code exists. Hepatitis C coding. Acute hepatitis C is coded as B17.10. Chronic hepatitis C is coded as B18.2. Always add any documented complications. Mycosis, fungal infections. Fungal infections are coded from B35 through B49. Examples include oral candidiasis and aspergillosis. Site and type of fungus must be identified when documented. Parasitic diseases overview. In this section, we will review parasitic diseases. Parasitic disease codes are found in categories B50 through B64 for protozoal diseases and B65 through B83 for helminth infections. These include conditions such as malaria, amoebiasis, giardiasis, and schistosomiasis. Malaria coding. Malaria is coded from categories B50 through B54. Codes specify the type of malaria and, when documented, the species. For example, B50 is used for Plasmodium falciparum malaria, while B54 is used when malaria is unspecified. Amoebiasis and giardiasis. Amoebiasis is coded from category A06, and giardiasis is coded as A07.1. Code selection depends on whether the infection is intestinal or extraintestinal and whether complications are present. Helminth infections. Helminth infections include parasitic worms such as hookworm, ascariasis, and tapeworm infections. Examples include B77 for ascariasis and B71 for cysticercosis. Always select the most specific code available. Sexually transmitted infections. Sexually transmitted infections are coded from categories A50 through A64. These include syphilis, gonorrhea, chlamydia, and trichomoniasis. Correct identification of the organism and site is essential. Syphilis coding. Syphilis codes specify whether the infection is congenital or acquired and the stage of the disease, such as primary, secondary, or latent. Early syphilis is coded from A51, while late syphilis is coded from A52. Congenital syphilis. Congenital syphilis is coded from category A50. Adult syphilis codes must never be used for newborns or infants. Gonorrhea coding. Gonorrhea codes specify the site affected and any complications. For example, gonococcal cystitis is coded as A54.01. Always review documentation carefully for site-specific details. Chlamydia infections. Chlamydia infections are coded from category A56. Examples include A56.01 for chlamydial cystitis and A56.4 for chlamydial pelvic inflammatory disease. Tuberculosis detailed overview. Tuberculosis codes are found in categories A15 through A19. TB classification depends on whether the disease is respiratory or non-respiratory and whether the diagnosis is confirmed or unconfirmed. Respiratory tuberculosis. Respiratory tuberculosis includes TB of the lungs. Confirmed respiratory TB is coded from A15, while unconfirmed respiratory TB is coded from A16. Confirmation status directly affects code selection. Non-respiratory tuberculosis. Non-respiratory tuberculosis affects organs outside the lungs. Examples include A18.0 for TB of bones and joints and A18.1 for TB of the genitourinary system. Primary TB infection. Primary tuberculosis infection is used mainly in newly infected patients. Confirmed primary TB is coded as A15.7, and unconfirmed primary TB is coded as A16.7. TB of the nervous system. Tuberculosis of the nervous system includes serious conditions such as TB meningitis and tuberculoma of the brain. These are coded from category A17 and represent high-severity diagnoses. Latent tuberculosis. Latent tuberculosis infection is coded as Z22.7. Latent TB is not active disease and must never be coded as A15 through A19. Tuberculosis sequela. When tuberculosis is no longer active but residual effects remain, use sequela codes from category B90. These codes indicate past TB with long-term consequences. Drug-resistant infections. When an infection is drug-resistant, an additional code from category Z16 is required. Examples include Z16.11 for resistance to penicillin and Z16.20 for resistance to an unspecified antibiotic. When to use Z16 codes. Z16 codes should be assigned only when drug resistance is clearly documented. Do not assume resistance and do not assign Z16 codes without provider documentation. Zoonotic bacterial diseases. Zoonotic bacterial diseases are transmitted from animals to humans and are coded from categories A20 through A28. Examples include plague, tularemia, and brucellosis. Localized infection with sepsis. When a localized infection leads to sepsis, code the sepsis first. Then code the localized infection. For example, sepsis due to peritonitis is coded as A41.9 followed by K65.9. Infection during pregnancy. Infections during pregnancy are coded using O98 codes. Sequence 098 first, followed by the specific infection code and the weeks of gestation using Z3A. Infection in newborns. Infections in newborns are coded from categories P35 through P39. Adult infection codes must never be used for newborn patients. Post-infectious conditions. Some conditions develop after an infection has resolved, such as rheumatic fever after streptococcal infection or post-infectious arthritis. A clear cause and effect relationship must be documented. Sepsis. Quick review. Let's quickly review sepsis. Sepsis is coded from categories A40 through A41 and represents a systemic infection. It is not the same as bacteremia. Sepsis may be present on admission or may develop during hospitalization. Severe sepsis review. Severe sepsis is defined as sepsis with acute organ dysfunction. Coding severe sepsis requires three components. First, a sepsis code from A40 or A41. Second, a code from R65.2. Third, a code for the specific organ failure. Septic shock review. Septic shock is the most severe form of sepsis. It is coded using the sepsis code plus R65.21. Do not assign separate codes for hypotension or shock. Implicit severe sepsis. This is a very important exam concept. If documentation shows sepsis along with acute respiratory failure, acute renal failure, or shock, severe sepsis is implicit. You must assign a code from R65.2, even if the provider does not document the word severe. Urosepsis reminder. Urosepsis is not a valid diagnosis code. If sepsis is documented, assign a sepsis code. If only a urinary tract infection is documented, code the UTI. Always query the provider when documentation is unclear. HIV coding summary. Let's review HIV coding. B20 is used for HIV disease. Z21 is used only for asymptomatic HIV infection. 098.7 is used when HIV complicates pregnancy. Once B20 is assigned, Z21 must never be used again. HIV sequencing summary. When HIV is associated with an opportunistic infection or tuberculosis, code B20 first. If the condition being treated is not related to HIV, code that condition first and assign B20 as a secondary diagnosis. Opportunistic infection review. Common opportunistic infections include pneumocystis pneumonia, Kaposi's sarcoma, candidiasis, cytomegalovirus infection, and toxoplasmosis. These conditions are always coded after B20. Tuberculosis review. Tuberculosis coding requires identification of the site, confirmation status, and whether the disease is active or latent. Active TB is coded from A15 through A19. Latent TB is coded as Z22.7. Sequela of TB is coded from category B90. Drug resistance review. When drug resistance is documented, assign an additional code from category Z16. Do not assume resistance and do not code Z16 without clear documentation. Pregnancy infection review. Infections during pregnancy are coded using 098 codes first. Next, assign the specific infection code, followed by the weeks of gestation using Z3A. Always follow obstetric sequencing rules. Newborn infection review. Infections in newborns are coded from categories P35 through P39. Never use adult infection codes for newborn patients. B95-B97 review. Codes B95 through B97 are used to identify the infectious organism only when the main code does not already include the organism. Do not assign these codes when the organism is built into the diagnosis code. Acute versus chronic infection review. When both acute and chronic infections are documented, code both conditions. Sequence the acute infection first unless a combination code exists. Common exam traps. Be careful to avoid common exam mistakes. Do not code bacteremia as sepsis. Do not forget the R65.2 code for severe sepsis. Never use Z21 after B20. Do not code latent TB as active TB. Do not forget B95 through B97 when required. Do not code hypotension with septic shock. Case Review 1. In this case, sepsis due to pneumonia with acute respiratory failure is documented. The correct coding includes a 41.9 for sepsis, R65.21 for severe sepsis, J96.00 for acute respiratory failure, and J18.9 for pneumonia. Case Review 2. For HIV disease with pneumocystis pneumonia, code B21st, followed by B59 for the pneumocystis infection. Case Review 3. For latent tuberculosis infection, the correct code is Z22.7. Case Review 4. For E. coli urinary tract infection with documented drug resistance, assign N39.0 for the UTI, B96.20 to identify E. coli, and the appropriate Z16 code for resistance. High yield areas for CPC exam. For the CPC exam, focus heavily on sepsis and severe sepsis, HIV rules, active versus latent tuberculosis, COVID-19 sequencing, proper use of B95 through B97, and drug resistance coding. Student coding checklist. Before finalizing infection codes, always ask yourself, is the infection localized or systemic? Is sepsis present? Is the organism identified? Is there organ failure? Is HIV involved? Is TB active or latent? Is drug resistance documented? Lesson 6 Summary. In Lesson 6, you learned infection coding fundamentals, organism and site rules, sepsis and severe sepsis coding, HIV and opportunistic infections, tuberculosis coding, sexually transmitted and parasitic diseases, drug-resistant infections, and special rules for pregnancy and newborns. Next lesson preview. In the next lesson, we will study Chapter 2, Neoplasms. You will learn about primary versus secondary cancers, history of cancer versus active cancer, metastasis, and treatment sequencing.